Hello, and welcome to Health is the Key, the podcast that explores the health and wellness issues that matter to 1199 SCIU healthcare workers. I'm your host, Elizabeth Moore. Today, we're talking about hypertension, or high blood pressure, a condition that affects nearly half of all adults in the U.S., which can lead to serious health risks. Yet, many don't experience any symptoms. And as with most things, early detection is key. So joining us today is Dr. Robert Ostfeld, a cardiologist and the founder and director of the Cardiac Wellness Program at Montefiore Medical Center. Dr. Ostfeld, a self-described reformed cardiologist, more on that later, will explain the numbers, outline the risk factors and symptoms, and share the not-so-secret secret to maintaining a healthy blood pressure. Welcome to Health's the Key, Dr. Ostfeld.
Oh, thank you so much for having me here today. It's an honor to be here with you and to speak to your members. So thank you so much.
We're very happy to have you here. First, can we talk about the basics of hypertension or high blood pressure?
Sure, absolutely. So the heart pumps and then it squeezes blood out of the heart into the blood vessels in your body, creating a pressure in your arteries. And you need some of that pressure to get the blood to your brain, to your kidneys, to your fingers and toes. And like many things in life, there's a sweet spot. Sometimes it can be too low, which in the US is extremely uncommon, but it also can be too high, which is unfortunately obscenely common in the US. So when the heart pumps, it squeezes blood out and the arteries expand a little. And then when the heart relaxes and fills back up with blood, then the arteries relax. So if you've ever felt your pulse and like your wrist or your neck and you feel it maybe about once a second bouncing, well, it's bouncing up when the heart squeezes. When it goes down, that's the heart relaxing. When the heart squeezes and you feel the artery bound, that's the top number.
Okay.
So they say 120/80, that would be 120. That's the systolic pressure. And when it relaxes, the bottom number, that's the diastolic blood pressure. Now, there's a range of blood pressure readings, and normal is considered less than 120/80. And then there are some categories over that. And when people's numbers go higher, in addition to lifestyle change, which we can talk about, which is the cornerstone of treating high blood pressure, as well as many, many other things, sometimes doctors will add blood pressure lowering medications to further help protect you.
Okay. It's because you don't always have the same blood pressure every time you go to the doctor. What do the fluctuations mean? Lately, my blood pressure has been below 120. It's been like 115/80. And I'm like, why did it suddenly go down? I know that's better.
That's definitely better. And that's a rock star blood pressure.
Thank you.
So, yeah, that's great. So it's normal for blood pressure to fluctuate. But in general, if it's less than 120/80, we say that's normal, knowing that if someone has, if like you're running to the doctor's office and it's stressful and there's traffic and you can't catch the bus or, we know that there are transient periods when it can go up. And that may happen because of stress hormones being released could squeeze the blood vessels a little bit more. And that's why we recommend checking blood pressure when you're relaxed, sitting down.
Right.
And if you're checking it at home, your blood pressure, which is a wonderful thing to do, the more data, the better. And it's really recommended when we're 18 years of age and older to start screening for high blood pressure just by checking your blood pressure with a blood pressure cuff on the arm. And if you're checking it at home, it's recommended that you sit, you relax for a few moments, have your back supported, feet on the ground, your arm at kind of heart level, and then you check the pressure. If you're normally 120/80 and at one time when you get cut off in traffic, it spikes up to 135, that I wouldn't be worried about.
Right.
But if you're consistently high, I would be worried. And another situation, of course, to be worried is if you're having symptoms of heart disease, which sometimes can go along with high blood pressure or be for any number of reasons. So if someone's having chest pain, shortness of breath, chest pressure, tingling in the arms or neck, those are concerning signs of an acute heart problem. You may want to call 911.
So we talk a lot about high blood pressure, but how common is it?
Unfortunately, it's very common. Around 46% of adults in the US have high blood pressure. And there's a statistic that blows my mind. And each time I read it, I have to go back and reread it because I just like, this can't be real. But if you're around a 45 or 50-year-old adult in the US, your lifetime risk of developing high blood pressure is around 85%.
Wow.
All right, so that's a real blight on the Western style lifestyle. So unfortunately, high blood pressure is very common in the US.
We've read that most adults who have high blood pressure don't know they have it.
That's 100% correct because just like, you were noting, it's the silent killer. And that's why screening is so important, because if you have high blood pressure, and it can meaningfully increase your risk of stroke, your risk of heart disease, heart failure, kidney disease, as well as a host of other kinds of problems. And so that's why, screening at home, seeing your regular doctor, and having it screened, and sometimes even in various pharmacies, if you're waiting to pick up a prescription or whatever, they may have something where you can sit and check your blood pressure. So screening regularly is very advisable.
So high blood pressure in and of itself isn't the terrible thing. It's the health risks that are associated with it.
Well, I think you're right. I mean, it's all of the above. And it starts to become tough to tease these things out, right? So if you start to think, why does someone have high blood pressure? Most of the time, it's from some combination of suboptimal lifestyle factors, and there certainly are genetic contributions as well. But lifestyle is a major contributor to that. And what do I mean by that? So an unhealthy diet, lack of exercise, a lot of salt intake, a lot of alcohol intake, suboptimal sleep, such as something like sleep apnea. And then high blood pressure could put a strain on the kidneys, for example. And then if there's some kidney disease, that can raise high blood pressure. So it's sort of a negative feedback loop. And so by adopting the cornerstone of therapy for high blood pressure and for preventing the development of high blood pressure is, of course, lifestyle change, which is good for you for blood pressure reasons, but for dozens and dozens of other ones. So it's really quite a bang for your buck if you're adopting the healthier lifestyle. And so the key cornerstone is how you eat, and eating more plant-based foods, tons of vegetables, fruits, whole grains, beans, lentils, chickpeas, peas, tofu, baked potatoes, salads, raw nuts. Obviously, these are general recommendations. And there's, in terms of a dietary pattern, which is really a great way to think about it, there's the DASH diet, the DASH, Dietary Approach to Stop Hypertension diet, which is very well studied in helping to reduce blood pressure. And it does a great job of that. And then, of course, the healthful Mediterranean style diet as well, which is really primarily plant-based. And it's like in the Western world, sometimes we eat whatever we want, put olive oil on it and call that Mediterranean. That's not really. Mediterranean is primarily plant-based, as is the DASH diet as well. It is primarily plant-based.
What is it specifically about plant-based foods that lower your blood pressure?
Yeah, so it's the anti-inflammatory, antioxidants, not eating the junkier stuff, improving the gut microbiome, improving blood vessel function, lowering cholesterol. And these things all work together for a symphony of benefits. And if you have high blood pressure, the DASH diet's been very well studied and can lower the top number, the systolic blood pressure, on average, maybe by about 10 points.
Wow.
And that's quite meaningful. So putting aside the many other benefits of eating more healthily, just from a blood pressure perspective, if you lower your top number consistently by about 10 points, that can reduce your risk of cardiovascular disease in the future by about 20%. So that's really wonderful. And that's just one piece of the puzzle. So from a lifestyle perspective, as the cornerstone of preventing and treating it, there's nutrition, there's regular exercise, going for a brisk walk, riding a bike, anything you like is wonderful to do. Ideally, at least 20 or 30 minutes a day, but we'll take what we can get. Something is better than nothing.
And spread out. You don't need to do it all at once. So
However works best for you. I encourage my patients to, if they can get 10 minutes here, 10 minutes there, people are busy, that's great. So cumulative. And so that, as well as having multiple other benefits from just a blood pressure perspective, can lower the top number maybe by about 5 points. Reducing alcohol consumption. Alcohol can increase blood pressure, and as well as having other bad effects that can promote cancer and other things. But that can lower the top number if you drink substantially less by about 5 points. So all of those things help high blood pressure, help dozens and dozens of other medical issues, are the cornerstone of both preventing and treating high blood pressure. And then, of course, when that may not be enough, it's still good for you. But sometimes we'll add blood pressure lowering medications on top of that.
And can you ever get off the medication?
100%. You 100%. If you're adopting a healthier lifestyle, your body may become more healthful and lower blood pressure over time. And then you may be able to come off the medication. And to be perfectly frank, I see that quite regularly in my wellness patients who adopt a plant-based diet. And what'll happen is they start the diet, and let's say they're on a couple of blood pressure pills. What'll happen is 2 or 3 weeks later, I'll get a phone call and they're like, "Hey doc, I'm a little lightheaded." And what it is their blood vessels are getting so healthful, their blood pressure is starting to come down, that we need to start to peel off some of the blood pressure pills. When my patients really adopt much more of a plant-based diet that I see, that's the one that most routinely happens the quickest.
Okay. So the positive news is that there are so many different ways to approach lowering your blood pressure: sleep, exercise, diet. So I wanted to get into the diet because that is your main focus. So first, can I just ask you, what do you mean you're a reformed cardiologist?
Well, all right, I'll have to reveal the secret. When I went through many years of medical training, of course, like all physicians, med school, residency, sometimes I did, some will do a fellowship. I did one in cardiology and learned a lot of great, incredible things: diagnosis, treatments, procedures, all sorts of things. But I didn't learn a lot about nutrition. And when I finished up my training, I kind of knew that a Mediterranean style diet was healthy, but I couldn't really define it. And then I came down to Montefiore to start to work, and I did all the things that I was trained to do: medications, procedures, maybe encourage people to eat a Mediterranean style diet, but I couldn't really get into it much more. And people would get better, which was terrific, but they weren't getting tremendously better. And I didn't go into medicine for people to get just a little bit better. I really wanted transformational change. So I was starting to get a little disillusioned. And it was right around then that I really learned about the impact of nutrition, of more plant-based diets, started using that with our patients. And to be honest, I've never seen anything come close to the breadth and depth of benefits that a plant-based or primarily plant-based diet provides. So I consider myself reformed by now anchoring my recommendations in lifestyle change and nutrition. And of course, we recommend medications and procedures too, but that's how I consider myself reformed.
It's kind of a hard sell for some people, not anyone in this room. But you don't want 5 days of meat in your regular diet. So how do you start weaning off?
Well, that's a great question, and every little bit counts. There's any number of studies that show the more toward a fully plant-based diet you adopt, the better you do. Every step toward a healthier diet, a healthier lifestyle is critically important. In my clinic, I have a handout that I'll give people where I have specific goals that will set certain numbers of servings of fruits and vegetables each day. There are tons of websites online that have recipes that people can use. There are documentaries out there, cookbooks, so lots of resources that are a click away online of meals that are really quite tasty, quite filling,
Mhm.
and very nutrient dense. So, what you could do is some people will start, all right, let's start one day a week
Mhm.
to be completely plant-based. And I see people who are enriched for disease and they're looking to turn things around pretty quickly. Some people will try to dive all in right away.
Mhm.
Some people will say, okay, let's just replace breakfast instead of the sort of the breakfast meats and
Mhm.
other fatty things. I'll have more fruits and a whole grain cereal or something.
Oatmeal, yeah.
Exactly
Mhm.
right. And some people just replace breakfast and lunch or any way to slice or dice it that works for you, and then just keep building up as much as you can. And anyone's sense of perfection does not need to be the enemy of good. Every step in the right direction
Mm.
helps.
Well, you had mentioned earlier about diving right in, and I know that there's a caveat sort of about diving right in because I'm not a big fruit eater. I eat lots of vegetables, but I'm not crazy about fruit. So one day I tried to get my 5 servings, and I felt so bloated and so sick the next day, and I was like, so my expertise is don't dive totally in if you're not used to this kind of diet.
Yeah, I mean, that's a really great point.
Mm.
And so you'll kind of know yourself. And so if someone feels that way, then we try to transition a bit more slowly. And it may have to do with your gut microbiome, which
Mhm.
are critically important for health. And we're really only scratching the surface of. And of note, a high fiber plant based diet appears to optimize
Mhm.
the gut microbiome, but it can take a little while for
Mhm.
your belly to get used to stuff. So sometimes, people may feel a little bloated after having a lot of beans or lentils. So we'll start more slowly.
Mhm.
If someone doesn't react well to fruit X, Y, or Z, well, then
Mhm.
there's fruit A, B, or C. So there's a lot of options out there.
So if you in particular have a gut problems, you probably shouldn't start on this on your own. You should check with your doctor and get some.
100%.
Yeah.
You're totally right. You have your own physician, your own medical team. Oftentimes, people will work with a registered dietitian, RD, or
Uh-huh.
a nutritionist to help you along the path. And there's a lot of people out there who know a heck of a lot more about this than I do, who can be very helpful with you transitioning to a more healthful diet.
Okay. I think many people do fall into the all or nothing I can't ever have that again. That's bad for me. Or, well, I'm just going to, treat myself.
It's extremely nuanced for each person
Mhm.
because we're all different. And a path that may work for one person may not for another. So you kind of have to know yourself. And I
Mhm.
have some patients who they went, they had a lot of uh, heart issues and they went almost fully, like 95% or more plant based. But the kinds of
Mhm.
improvements I see, it's awesome.
Huh.
It is just it's why I became a physician to help people really get better.
Mhm.
But, this is something we want people to do, eating and living more healthily for 30 years, not 30 days. Like pretty much anybody could do something for 30 days, but doing it in a way that is sustainable for you. And I have one patient, once a month, he and his family, they have a giant cheat meal and they rally around that.
That's
There's
great.
it's like it's there, they live for it, they plan it, it's like a whole big thing, and that's great. Have at it. And he's had incredible improvements. And other people, maybe once a week, or maybe some people go 50% of the way more. Anecdotally, when
Mhm.
people tell me they go more than 50% plant-based, that's when I really start to see improvements. I have no way to measure that. It's just what they tell me. When they say they're going like 90% or more, is when I start to see just the most incredible uh, changes.
Like in terms of blood pressure and.
Blood pressure, cholesterol.
So for our healthcare workers who are on tight schedules and busy lives, how do they start working into a plant-based diet? Because no one can go from, being a 5-day a week carnivore to a complete plant-based diet. So how can they get started?
That's a great question. And we want to make it as easy as possible. And like you said, everyone is incredibly busy. So here are a few ideas with which to start to begin to make the change. And you can certainly look in websites at the American College of Lifestyle Medicine and online that can have recipes and things like that. One idea is to bulk cook. So if you make a lot of meals on a Sunday and you can freeze them, a big vat of a bean and vegetable soup or something, and you can freeze it and eat that over the course of the week. Another one is for breakfast having oatmeal, and sometimes you can even set that up the night before, whole oats, not the instant oatmeal,
Mm-hmm.
but having that ready for breakfast in the morning. The fruit is, you can have an apple right next to it. You could munch on that. One thing that I'll do, and some of my patients do, is they'll have greens in the refrigerator. And I do encourage my patients to have 2 or more servings of greens, sometimes even more each day.
Mm-hmm.
And one thing that I'll do is I'll just reach in the refrigerator, grab a handful of greens, rinse it, and put on a little vinegar and just eat it. And that's, probably about 22 seconds.
Mm-hmm.
And that helps you get in quickly and efficiently a serving of greens. And having healthful snacks at the ready, because when you're hungry is when you're most prone to grab the junk food out of the vending machine or whatever. But if you have a small bag of nuts, maybe you bring in a banana and you bring in an apple, those are ways to take the edge off the hunger and help you eat more healthfully. And I know at Montefiore Health System, the cafeterias have a lot of wonderfully healthful foods, vegetables, fruits, various plant-based meals that we can, purchase for lunch, for dinner. Those are some quick thoughts on that.
That's great. Well, I think we've covered everything. Is there anything that you would like to leave with our members to get a more heart healthy approach to eating and to just taking care of themselves?
Yes, absolutely. First, it's wonderful that you all are talking about this. It's unbelievably important. And there's so many ways that you can be healthier. And I would try to think about it and look at it as an exciting opportunity,
Mhm.
not like a chore.
Right.
And we get CAT scans, right? Looking for a problem. And that's great. It's good that we can diagnose and find things that way. But I thought, wouldn't it be cool if instead of looking for a problem, let's look for something good, right? So that's the Kale scan. What is the Kale scan? The Kale scan identifies things that are associated, sometimes not definitively, but associated with improving when you eat more plant-based nutrition.
Hmm.
So let's just do a Kale scan top to bottom. So eating more healthful plant-based foods, vegetables, fruits, whole grains, beans, lentils, etc., is associated with an improved mood. It's associated with less anxiety, less stroke, improved cognitive function, less dementia, less heart disease, less heart attacks, reduces some kinds of cancers. It's associated with weight loss, less diabetes.
Hmm.
So, like we were talking about, there's a symphony of benefits eating this way. Yes, it's good for blood pressure, but good for you for dozens and dozens of other reasons. And who wouldn't want to have those things for themselves
Mhm.
and for their family? So, it's great. And in my opinion, it's never too early to begin and never too late to start.
That's perfect. That's great advice for our members and their families. So thank you so much for your time. We learned a lot today that we'll take home with us.
Thank you. It's a real honor to be here today. And since we're in the Big Apple, I guess I'd say have an apple in the Big Apple.
Thank you. Be sure to tune in later this month to our May keynote to hear Dr. Ostfeld talk about how poor sleep can raise blood pressure and how, you guessed it, eating a more plant-based diet can improve both. For more information on what you heard today, please check our show notes. And remember, subscribe to Health is the Key wherever you get your podcasts. This podcast and its content are presented solely for general informational and entertainment purposes. The information and opinions provided on this podcast are not intended as legal or medical advice and do not constitute or serve as a substitute for professional medical or psychological treatment, diagnosis, therapy, or other types of professional intervention.